guys, it's Khaki. Today I'm going to talk about something that I frequently get asked both as a weight loss surgery patient and a healthcare provider. What kind of questions do I need to ask at my pre op appointments? So let's talk about it. First thing that I suggest that you find out, and this will probably be done before you have that initial appointment, is insurance coverage. Is my insurance going to cover this? And if so, what will my copays be? What are the requirements from my insurance to qualify for surgery? I know that I see all different types of insurance requirements in my office. A lot of insurances will require, in addition to so many meetings with your bariatric team and with the dietitian and support groups, a psychiatric consult, a lot of times insurance will require you to have so many monthly visits with your primary care provider to discuss weight loss. And honestly, I think it's really just to weed out the people who are not going to do the follow up. Although I have found most people, once they jump through those hoops, most people are going to do the follow up, but I don't necessarily think that's a good indicator of dedication. But those are the insurance requirements for a lot of people. My insurance did not require anything like that. My insurance required a psych eval, a meeting with the dietitian, a meeting with the surgeon, and 3 support groups before they would pay. So, like I said, every insurance is different, and that's something that you should be able to find out from your insurance company and from the surgeon that you are looking at from his office before you go. First step to that, call the number on the back of your card. Ask them if you have coverage for bariatric surgery. They can probably get you in the right direction. The next thing that I would make sure of before I scheduled an appointment with a surgeon is, are they in my network with insurance if you're going to be using insurance? Once you actually are sitting in front of that surgeon, these are the things that I think are good to know. Ask about experience. How long have you been doing these procedures? Is there one procedure that you do more than the other? What is your complication rate? My surgeon was very open with that. He had had 2 different patients die following surgery. He shared with me in a general way what the details of those occasions were. He had over 30 years' experience doing bariatric surgery. He was able to tell me how many post op infections he had had, how many rehospitalizations. These things happen. It's good to have a surgeon who is open about that and for you to know what you may be facing. Another thing that I think is a good thing to know is what kind of certification does your surgeon have? Is he or she a member of the ASMBS, which is American Society of Bariatric and Metabolic Surgeons? I think it's also good to know, is this a general surgeon? Is this somebody who specializes in bariatrics? What kind of education do they have? These are all things that you can probably find out before your appointment, but if not, I would ask. Another thing is, what hospital are they affiliated with? A lot of times you're going to see a surgeon in a freestanding clinic. And if you live in a large area, it may be that there are 2 or 3 hospitals in your area. You need to find out, which hospital am I going to be having my surgery at? Which hospital do I need to go to if I have an emergency for follow up where you can see me? Also, what when you go in, I think that you need to have a list, obviously, of your medical history, any past surgeries, any medications you take. What are your expectations? What would be a goal weight or goal size for your mind? For example, if you weigh 250 pounds and you want to weigh 150 pounds, Talk to the surgeon about that. If you have acid reflux, that is a big decision maker in what surgery you have. Once you present your medical history, your expectations or your hopes, your medications, then say to the surgeon, with everything I've just shared with you, which surgery do you feel like fits me best? Which surgery will help me get to where I want to be? One thing that I would caution, if your surgeon only does one surgery, I would be a little hesitant. Of course, they're going to say that's the best surgery. I would want to know, why are they only doing that one surgery? Are they not experienced? Are they not qualified? Have they not been trained in other techniques? So you want to make sure that you go to someone who can give you choices, who can tailor your plan of care towards what's actually best for you, not it's the only thing they do. I would ask them, okay, so let's say you do the sleeve, you do the SADie or the duodenal switch, and you do the bypass. What are my expected weight losses with each one? If I qualify for all three, what can I expect to lose? If you want to lose 100 pounds and your surgeon thinks that is a realistic goal for you, what if I have the sleeve and they say, well, you're probably going to lose 70 pounds? Okay, so what would I lose if I had the gastric bypass? That will help you in your decision making. These are hopefully people who do a lot of these surgeries and have a lot of experience with outcomes. Another question to ask, how long am I going to be in the hospital? What is the expectation for that? I know some of our local surgeons for a gastric sleeve do it on an outpatient basis. Others don't. I think pretty much everybody in our area, if you have a bypass, you're going to spend at least one night in the hospital. So find out, how long do I expect to stay? What are my restrictions going to be after surgery? This is a big thing. If you work outside of the home, if you have children, if you're a caregiver for a family member, you need to know, am I going to have a lifting restriction? How long is that going to last? Am I going to have a restriction of certain activities? How long is that going to be for? These are things you need to know. What's my recovery going to look like? Do I have expectation of, if I have a job that requires lifting, how long am I going to have to be off work? What do you feel like you should say to your surgeon if you have small children? How long do I need to have help on hand? Do I need to have a family member come stay with me? What are those expectations? Another thing that a lot of folks don't think of, if you take medicine, you need to find out, what medication changes do I need to make after surgery? If you are on an extended release medication, which a lot of meds are, that very well may need to be changed. If you take a medication that is, for example, metoprolol, that is used for blood pressure and for pulse. I took that prior to surgery. I took an extended release once a day. After surgery, I had to change that to an immediate release twice a day because extended release just doesn't absorb in the anticipated way following bariatric surgery. I was able to get off of it, though, within a couple of months after surgery, after I lost a significant amount of weight. I didn't need blood pressure medication anymore. So you need to find out about that. Go over your medication. A lot of times, psychiatric medications, the absorption can be affected by surgery. That's something your surgeon needs to talk to you about, and you need to ask. What's my diet progression going to look like? Every practice is different. Are you going to be on a liquid diet for 2 weeks before? A liquid diet for 2 weeks after? When can I start eating soft food? When can I start eating fresh fruits and vegetables? Just for you to get in your mind, I think it's good to know what's next. Don't hyper focus on what's next, but just kind of know. Okay, I may not be able to have a salad for 3 months. I may not be able to eat fresh fruit for a couple of months. Those are the things that you need to know. You need to know what foods post op am I going to need to avoid. Things like nuts, seeds, things that you just need to know how to plan. What vitamins do I need to take? Vitamins are a forever thing. So, what do I need to take? Are there certain brands that you recommend? The dietitian is probably your go to on this. Uh, I really recommend having a discussion about that before surgery so that you can be ready. When do you suggest I start these vitamins? I know my bariatric team told me start them when you can keep them down. There was not a wait 2 weeks kind of thing. It was when you comfortably feel like you can get them down, start them. I've seen other teams that suggest a liquid vitamin for so many weeks after surgery, then transitioning to a chewable or a pill form. This is a big one. What is my follow up going to be like? Speaking of my experience, I had, I think, a 1 week follow up, a 2 week, a 1 month, a 3 month, a 6 month, a 9 month, 12 month, 18 month, 2 year, yearly after that. You need to know what kind of follow ups am I going to have? Is that going to be with just the medical provider or is that going to be with the dietitian as well? And last thing that I would suggest is what kind of support am I going to have post op? Most places have support groups pre op that you have to go to. Do you offer support afterwards? Do you have support groups virtually or in person? Who can I call if I have questions? How can I access or get in touch with your dietitian? How do I get in touch with the medical provider? Do you have a portal that you can reach out to somebody? Do you prefer a phone call or do I need to make an appointment? Are these people going to be accessible to me? So, those are the things that I would suggest you ask. Every situation is unique, every person is different. I'm sure there are things that I did not cover. I would love to hear from you. What questions did you ask in your pre op visits? Are these things that you ask? Are there things that you wish you had asked and didn't? I would also love to hear any suggestions for future videos. I want to put content out that helps people. If you have any questions, please put them in the comments below. I will be glad to answer any way that I can. I hope everybody has a great week, and we will see you next Wednesday. Bye.